Hello, my name is Michelle Yahia, student nurse practitioner. I'm here with VG, going to do a complete assessment. Do you agree to be videotaped?
Yes, please.
Okay, so we're going to do a quick tour of the room. As you can see, there's nothing on the floor of the walls or the table beside me, nothing on the floor. Okay, so to get started, we're going to do we'll start with the head, and I'm going to assess the skin as we go through each assessment component for time. So we're going to start with the head. First thing I'm going to look for is symmetry. I'm looking at facial features, make sure that they are symmetrical, no tics, no tremors, no masses, no deviations. And the first thing I'm going to do is feel the scalp. And I'm just feeling for any tenderness, masses, any lesions. Everything looks fine. Make sure it's round, the size and the shape. And then the next thing I'm looking at, I'm going to look at your eyes, and I'm looking at the shape, the papilla fissure, and I'm going to look at the sclera, and it looks nice and pink. Then the next thing I'm going to do, we're going to check for your pupils. So I'm just going to flash the light. And I'm going to look at your eyes. So I'm looking at your eyes. And what I'm looking for is for the pupil dilations on both sides. And they look good. Okay, so I'm going to have you watch the top of my pen. I'm sure you can see. Keep your eyes focused here. Don't turn your head. We're going to go off to the side. We're going up. Okay, continue watching the tip of my pen. And I'm looking at your eyes to make sure that they follow evenly. And they do. They're looking pretty good. So the next step I'm going to do, I'm going to use the otoscope here. Turn it on, make sure it's down to 0. Okay. And I'm going to look in this eye here. And what I'm looking at is that the red fundus inside. I'm going to look up here on this side. Okay. Okay. So the next step I'm going to do is I'm going to look inside your ears. But before we do that, I'm going to do a whisper test. So I'm going to plug your ear here. And I'm going to whisper something. And I want you to repeat it. Baseball.
Baseball.
And then we're going to do this side. Race car.
Race car.
Okay. So I'm going to look inside your ear. I'll put your ear back just a little bit because I'm looking for the tympanic membrane. And I'm looking for any redness, swelling, drainage. Okay. So the next thing I'm going to do is we're going to look in your nose. I'm just going to kind of take a quick peek. And what I'm looking for is any redness, drainage, a deviated septum. Okay. So then I'm also going to look in your mouth, and I'm looking at the skin, the color, make sure there's no cyanosis. And I'm just going to pull this back, just a little back, and I want to look at your gums. Okay, open your mouth here for me. And I'm looking at all his teeth, the hard plate, the tongue. Can you lift your tongue up for me? Lift it up. Okay, and stick it out and say ah. Okay, good. And the soft palate moved nicely. So then the next thing I'm going to do is I'm going to have you raise your eyebrows really high and make a frown face. Okay. And then on your mouth, I want you to smile real big and now frown really big. Frown. Like, okay. And clench your teeth one more time. Okay. And puff out your cheeks like a fish. There you go. Okay, so I'm looking at all the cranial nerves. So the next step I'm going to do is we're going to look at your neck and your lymph nodes. So I'm going to palpate here in front of your ears first. And then your mandible. Okay, I'm just going to kind of palpate right here in your neck. And then down here in your cervical. Down your neck. Down here in your clavicle. Okay, I'm going to have your head, turn your head to one direction, and I'm going to feel down in here. And what I'm feeling for is any lymph nodes that might be enlarged. Okay, the other direction, please. Okay, look straight ahead. And I'm going to feel your thyroid in there. Okay, can you swallow for me with your head up like that? Okay, perfect. And I can see that a nice even movement. Okay, so then the next thing we're going to go ahead. So the next thing I want you to do is I want you to put your chin to your chest and then flex it all the way back as far as you can. And then put each ear on your shoulder blade. And the other side. And then turn your head back as far as you can in each direction. Perfect. Okay. And push up against my hands. Okay, perfect. Okay. So the next thing I'm going to do is we're going to do the thoracic and the your chest and the cardiac. So the first thing I'm going to do is I'm looking at symmetry. I'm looking at the way you're breathing. I'll put my hands on your chest here just to take a deep breath. Okay, and if you could turn around so your back is to the camera. Yeah, perfect. Okay. So the first thing I'm going to do is I'm looking at the skin and making sure there's no moles, and I see a mole here. This is the first mole I've seen. It does have irregular borders. It is less than 6 millimeters in size, but it's definitely something to take note. We have a small nevi here, and the spine does look straight. So the first thing I'm going to do is I'm going to do some palpation. Take a deep breath. And take a nice deep breath for me. Okay, perfect. Okay. Take a deep breath. Okay, and I want you to say 99.
99, 99, 99, 99, 99, 99.
And I feel vibration all the way down. Okay, and so the next thing I'm going to do, because I already have you in this position, is I'm going to check for your kidneys for any tenderness. I'm just going to do a little pat on your back. Any pain with that?
No.
Okay, and go ahead and turn around. And so we're going to do the same thing here, but I'm going to take a quick listen to your back. Just take some nice even breaths. Okay. Okay, now I'm going to listen to your heart. So just breathe easy. Okay. We're going to do it again, but I'm going to do it with the bell of my stethoscope. I need you to lean forward just a little bit. There you go. Okay. I'm just going to listen to your carotid. Okay. So then the next thing I'm going to do is I'm going to look at your arms. And again, I'm going to check your temperature here on each arm. And I'm just assessing, make sure there's no heat, no inflammation, no swelling. And I'm going to look at your arm here. And I'm just going to check your pulse there real quick. I'm going to do a quick balance test. And you have some nice blanching going on there. Okay. And I'm turning it over and I'm looking at your fingertips for any clubbing. And they have nice cap refill. I'm going to do the same thing with this one. Turn your hand over. Okay. No clubbing. Nice cap refill. Okay. So what I'm going to have you do is I'm going to have you bring your fist like this. There you go. And what I'm going to do is I'm going to try to push down on them, and you don't let me, okay? Okay, good. Now turn them this way. Put them up against your hand. So what I'm going to do is I'm going to push down on them, and you don't let me, okay? Okay, and then I'm going to push up. Okay, and I'm going to push in, and then I'm going to push out. Good. And we're going to do the same thing with the elbows. Okay, lean them out just a little bit. I'm going to push in, and you try not to let me. And then I'm going to push out, and you try not to let me. Okay, good. So I'm going to check your flexion arm here that you have good movement, and your wrist as well. So the next thing I'm going to do, and I would do this on both sides, but for time, we're not going to. I'm going to put my hand right here, and I want you to stretch your arm all the way out, and then raise it up to the sky. There you go. Any crackling or pinching? Okay. And I'm going to put my hand on your scapula, and I want you to do the same thing. Okay, and back down. Perfect. Okay, so now I'm going to have you lay down on the bed. And let me adjust this just a little bit. There we go. So the next thing I'm going to do is we're going to look at your abdomen, and I'm looking for any swelling, any masses, any deviations, if you had any ascites, which it doesn't look like you do. So the first thing I'm going to do is we're going to listen to all 4 quadrants. Okay, then I'm going to listen to your aorta. That's your liver. Over here's your gallbladder. I'm listening for any hums. I'm going to listen to your iliac and the femoral. Okay. So now what I'm going to do is I'm going to do some gentle palpation on your stomach. Any pain anywhere that I need to be aware of?
No.
And I'm listening for the change of sound, and your liver would start about right there. So then I'm going to come up here to your rib cage. It's pretty small in there. And we're going to do the same thing here. Little dullness up there on the top. Okay, now I'm going to do some deep palpation. Deeper. And again, I'm just feeling for any masses or any abnormal. Okay, take a deep breath for me. And hold it. Take a deep breath and hold it. Okay, now you relax. Okay. And again, a deep breath and hold it. Okay, relax. And I'm going to feel for your aorta right here. It feels very slender in size. Okay. So the next thing I'm going to do, I'm check. So your McBurney's point would be here, and I can press down on that if you have an appendicitis, and that will cause some pain when I push on that. And on this side, if I pushed in, out, you would have a rebound tenderness, no pain? Okay. So the next thing is, here, another sign is I want you to put my hand against your knee, and I want you to try to lift up on it a little bit. Any pain?
No.
No? Okay. So then I'm going to palpate for your arteries here. Okay. And I'm going to go right here. Just go ahead and relax. Just relax. And as I'm looking down his legs, I'm also looking at the skin for any edema, any color variations, and his legs are nice and warm. And at the top of his foot here, I'm looking for that pulse, which would be about right there. And you have a nice strong pulse. And again, a nice strong pulse. And you have good calf refill on your toes. No clubbing. Okay. On your feet, I want you to push up against my hands. Okay, and push down. Good. Okay, I'm going to lift your knee up just a little bit. And I'm going to move it a little bit. If it hurts, let me know. I'll stop and push it in. And I'm also going to move it outwards. I'm checking your hips. I'm going to move this in, and then I'll move it outwards. No pain? Okay. Then I'm going to check your knees here with any movement. No swelling. Okay, and you can go ahead and sit up for me. So what we're going to do here is I reposition the camera. I'm looking at your knees here, and again, I'm looking at the muscle structure, no edema. I'm looking at the hair, make sure that they're good, even hair across the legs for vascularization. And what I'm going to do here is I'm going to do the same thing we did with your elbows. I'm going to push in, and you push out. Don't let me push you in. Okay, and we're going to do the same thing here. Okay, good. And here on your shins, I want you to push out, and now push back in. Okay. Can you lift your leg, one leg straight out? Okay, and the next one, put it down. Okay, good. Now with your toes, you can see, point your toes straight down to the floor. Now lift your toes up and move your toes inwards and then outwards. And I didn't do that with the hands. If you could put your hands out this way. We did make one mistake here that we forgot. So with your fingers, I'm going to do the same thing. put your fingers together. I'm gonna try to pull them apart and you don't let me, okay? Okay, now spread them all out and push in and you don't let me. No, don't let me push in. And do the same with your thumbs and outwards. And then the same thing, move them up, move your fingers to the ceiling and turn them over, move your fingers down to the floor, move your fingers inwards and then outwards. Okay, perfect. Okay, thank you. And then with your feet, what I want you to do is here at the knee, try to take this foot and move it out that way. No, the whole foot, yeah. Like move your leg this way and then go ahead and move your leg inwards that way. Perfect. And this one as well. Move it inwards and then move it outwards. Good. Okay. If you can stand up for me. What I'm going to have you do, kind of hard to see, is I want you to bend over and touch your toes. Can you bend over and touch your toes? And then I want you to stand up, all the way up, and lean back as far as you can without falling. Okay, perfect. And I want you to lean as far as you can to one side and then the other side as well. Perfect. Okay. Now if you can just kind of step back here a little bit. It's gonna be kind of hard to see, but we're gonna work on it. No, right here. I want you to get on your tippy toes, walk to the dresser, and then come back walking on your heels. And I'm looking at balance. There you go. And turn around, come back, and walk on your heels. No good. Okay, just stop right here. And what I'm gonna have you do is leave your hands to your side, close your eyes, and this is a balance test. So I want you to just stand there for a second with your eyes closed, and I'm looking for any drifting to one side or the other. Your eyes closed. Okay, good. And now I'm gonna have you reach your arms straight out, like this with your arms up. Close your eyes, and I want you to keep them in this position, okay? Perfect, okay, go ahead and relax. Now, so what we're gonna do is, I'm gonna have you go ahead and sit down here for a minute. We're gonna have what we call like a sensation test. Very quick and rapid, only take a second. And what I'm gonna do is you're gonna close your eyes and you're gonna tell me if it's a soft touch or a hard touch, okay? And I'm gonna keep your eyes closed.
Soft. Hard. 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 Soft. Soft. Hard. Hard.
Okay, and I'm gonna go down to your legs and we're gonna do the same thing. You tell me if that soft.
Hard. Hard. Soft. Soft.
Okay, good. Keep your eyes closed. And what I'm gonna do is have you hold out your hand with your eyes closed. And I'm gonna write something on your hand and you tell me what number it is.
8.
Okay. And can you tell me what this object is?
Penny.
Okay.
Cent. Penny.
Okay, I'm gonna check this one.
3.
And what is that?
Penny.
Okay, good. So we've got one more test to perform. And this here's just your reflexes. So what we're going to do and hold your arm up like this. There you go. Okay, good. We're gonna do the same thing on this arm. Relax your arm. Just relax a little bit. And bring your arm up like this. Okay. Relax your legs. Okay. And bring your ankle up. Can you bring your ankle up like not that far? Just a little bit over, just so we can see it. Okay. I'm going to do the same thing to the other foot. Hang over the edge just a little bit there. Okay, and relax. Okay, and that concludes our exam. How long did it take? You took it 30 minutes?